Toxic inflammation, one due to a poison, E.G., a bacterial product. Traumatic inflammation, one that follows a wound or injury. Ulcerative inflammation, that in which necrosis on or near the surface leads to loss of tissue. It's reserved. Inflammation is a fundamental pathologic process consisting of a dynamic complex of histologically apparent cytologic changes, cellular infiltration, and mediator release that occurs in the affected blood vessels and adjacent tissues in response to an injury or abnormal stimulation caused by a physical, chemical, or biologic agent, including the local reactions and resulting morphologic changes, the destruction or removal of the injurious material, and the responses that lead to repair of inflammation. A protective tissue response to injury or destruction of tissues, which serves to destroy, dilute, or wall off both the injurious agent and the injured tissues. The classical signs of acute inflammation are pain, dolor, heat, calor, redness, rubber, swelling, tumor, and loss of function, functiolessa. Help of inflammation in wound healing. Our immediate reaction to a swelling is to try to bring it down, bearing in mind that inflammation is an essential part of the body's attempt to heal itself. Patients and doctors need to be sure that the treatments to reduce swelling are absolutely necessary and to not undermine or slow down the healing process. Wrist inflammation. The first stage of inflammation is often called irritation, which then becomes inflammation, the immediate healing process. Inflammation is followed by suppuration, discharging of pus. Then there is the granulation stage, the formation in wounds of tiny, rounded masses of tissue during healing. Inflammation is part of a complex biological response to harmful stimuli. Without inflammation, infections and wounds would never heal. Inflammation as a part of our innate immunity. Our innate immunity is what is naturally present in our bodies when we are born, and not the adaptive immunity we get after an infection or vaccination. Innate immunity is generally nonspecific, while adaptive immunity is specific to one pathogen. What is the difference between chronic inflammation and acute inflammation? Acute inflammation. It starts rapidly and quickly becomes severe. Signs and symptoms are only present for a few days, but in some cases may persist for a few weeks. Examples of diseases, conditions, and situations which can result in acute inflammation include acute bronchitis, infected ingrown toenail, sore throat from a cold or flu, a scratch, cut on the skin, exercise, acute appendicitis, acute dermatitis, acute tonsillitis, acute infective meningitis, acute sinusitis, chronic inflammation. This means long-term inflammation, which can last for several months and even years. It can result from failure to eliminate whatever was causing an acute inflammation. An autoimmune response to a self-antigen, the immune system attacks healthy tissue, mistaking it for harmful pathogens. A chronic irritant of low intensity that persists. Examples of diseases and conditions with chronic inflammation include asthma, chronic peptic ulcer, tuberculosis, rheumatoid arthritis, chronic periodontitis, ulcerative colitis and Crohn's disease, chronic sinusitis, chronic active hepatitis. Our infections, wounds and any damage to tissue would never heal without inflammation. Tissue would become more and more damaged and the body, or any organism, would eventually perish. Chronic inflammation can eventually cause several diseases and conditions, including some cancers, rheumatoid arthritis, atherosclerosis, periodontitis, and hay fever. Inflammation needs to be well regulated. Acute inflammation. Within a few seconds or minutes after tissue is injured, acute inflammation starts to occur. The damage may be a physical one, or might be caused by an immune response. Three main processes occur before and during acute inflammation. Arterioles, small branches of arteries that lead to capillaries that supply blood to the damaged region dilate, resulting in increased blood flow. The capillaries become more permeable, so fluid and blood proteins can move into interstitial spaces. Neutrophils, and possibly some macrophages migrate out of the capillaries and venules and move into interstitial spaces. A neutrophil is a type of granulocyte, WBC. It is filled with tiny sacs which contain enzymes that digest microorganisms. Macrophages are also a type of white blood cells that ingests foreign material. Nature that neutrophils are the human body's first line of defense. They are the main cells that protect us from bacterial infections. Their protective function is a positive one, however, they also have inflammatory properties that may eventually lead to heart disease and several autoimmune diseases, such as lupus. Effectively manipulating neutrophils is vital in disrupting inflammatory diseases. When our skin is scratched, one may see a pale red line. Soon the area around that scratch goes red. This is because the arterioles have dilated and the capillaries have filled up with blood and become more permeable, allowing fluid and blood proteins to move into the space between tissues. The 5 cardinal signs of acute inflammation, PRISH. 1. Pain. The inflamed area is likely to be painful, especially when touched. Chemicals that stimulate nerve endings are released, making the area much more sensitive. 2. Redness. This is because the capillaries are filled up with more blood than usual. 3. Immobility. There may be some loss of function. 4. Swelling, caused by an accumulation of fluid. 5. Heat. As with the reason for the redness, more blood in the affected area makes it feel hot to the touch. The 5 classical signs of inflammation. Although Latin terms are still used widely in Western medicine and local languages, PRISH is a more modern acronym which refers to the signs of inflammation. 1. Dolor, Latin term for pain. 2. Calor, Latin term for heat. 3. Rubor, which in Latin means redness. 4. Tumor, a Latin term for swelling. 5. Functio lesa, which in Latin means injured function, which can also mean loss of function. These 5 acute inflammation signs are only relevant when the affected area is on or very close to the skin. When inflammation occurs deep inside the body, such as an internal organ, only some of the signs may be detectable. Some internal organs may not have sensory nerve endings nearby, so there be no pain present, as is the case with some types of pneumonia, acute inflammation of the lung. If the inflammation from pneumonia pushes against the parietal pleura, inner lining of the surface of the chest wall, then there is pain. Acute and chronic inflammation comparison. Acute inflammation. Causative agents, harmful bacteria or injury to tissue. Major cells involved, mainly neutrophils, basophils, in the inflammatory response, and eosinophils, response to parasites and worms, and mononuclear cells, macrophages, monocytes. Primary mediators, eicosanoids, vasoactive amines. Onset, when does the inflammation start? Straight away. Duration, short-lived, only a few days. Outcomes, the inflammation either gets better, resolution, develops into an abscess, or becomes a chronic inflammation. Chronic inflammation. Causative agent, non-degradable pathogens that cause persistent inflammation, infection with some types of viruses, persistent foreign bodies, overactive immune system reactions. Major cells involved, macrophages, lymphocytes, plasma cells, these 3 are mononuclear cells, and fibroblasts. Primary mediators, reactive oxygen species, hydrolytic enzymes, IFN, and other cytokines, growth factors. Duration, from several months to years. Outcomes, the destruction of tissue, thickening and scarring of connective tissue, fibrosis, death of cells or tissues, necrosis. Sleep quality and duration impacts on inflammation risk. Sleep deprivation or poor sleep quality raises inflammation, which in turn increases the risk of developing heart disease and stroke. Poor sleep quality and short sleep durations are associated with higher levels of inflammation. Why does inflammation cause pain? When people have inflammation, it often hurts. They feel pain, stiffness, discomfort, distress, and perhaps agony, depending on the severity of it. Pain can be constant and steady, in which case it is often referred to as an ache. Pain can be of a throbbing type, a pulsating pain, or it can be a stabbing or pinching pain. Pain is a very individual experience, and the only person who can describe it properly is the one who is feeling it. Pain can be acute or chronic. It can also be nociceptive pain. Specific receptors are stimulated for us to feel this type of pain. These receptors sense changes in temperature, vibration, stretch, and chemicals which damaged cells release. Nociceptive means causing or reacting to pain. The cause of the pain comes from outside the nervous system, and the nervous system reacts to it. Non-nociceptive means the pain comes from within the nervous system itself. Somatic pain. This is a kind of nociceptive pain. The sensation is felt in muscles, joints, bones, ligaments, and on the skin. Musculoskeletal pain is somatic pain. Pain receptors are sensitive to stretch in the muscles, vibration, temperature, as well as inflammation. When there is a lack of oxygen, there may be painful ischemic muscle cramps. Somatic pain tends to be sharp and localized. Touching or moving the affected area will result in more severe pain. Visceral pain. This is a kind of nociceptive pain. Pain is sensed deep down in the body, in the internal organs and main body cavities, such as the heart, lungs, bowels, spleen, liver, kidneys, bladder, uterus, and ovaries. The nociceptors, pain receptors, sense oxygen starvation, ischemia, stretch, and inflammation. It is harder to localize visceral pain than somatic pain. The pain is usually described as a deep ache. Cramping and colicky sensations are examples of visceral pain. Inflammation primarily causes pain because the swelling pushes against the sensitive nerve endings, which send pain signals to the brain. Nerve endings send pain signals to the brain all day long. However, it learns to ignore most of them, unless pressure against the nerve endings increases. Other biochemical processes also occur during inflammation which affect how nerves behave, and cause pain. Inflammation risk much greater if you are obese. Fat men have more inflammatory markers, WBC, than men of the same age who are not obese or overweight. Raised white blood cell levels are markers which are linked to a higher risk of developing various illnesses, including coronary heart disease. Unfit men had higher white blood cell levels than fit men. Men with higher BMIs had raised levels of white blood cells. The combination of fitness levels and body weights impacted considerably on levels of white blood cells, and ultimately inflammation. Although scientists know that inflammation plays a key role in heart disease and several other illnesses, what drives inflammation in the first place is still a mystery. Inflammation drops when women lose weight. Cancer Research Center in Seattle, Washington found that postmenopausal overweight or obese women who lost 5% or more of their body weight had measurable falls in levels of inflammation markers. Autoimmune disorders and inflammation. An autoimmune disease, also known as autoimmune disorder, is one where the body initiates an immune response to healthy tissues, mistaking them for harmful pathogens or irritants. The immune response triggers an inflammatory response too. There are literally hundreds of autoimmune diseases, and nearly all of them have inflammation as one of the signs. Examples include rheumatoid arthritis. There is inflammation in the joints, tissues surrounding the joints, and sometimes some other organs in the body. Ankylosing spondylitis. There is inflammation of the vertebrae, muscles, ligaments, and also the sacroiliac joints, where the spine and hips meet. Celiac disease. There is inflammation and destruction of the inner lining of the small intestine. Crohn's disease. The gastrointestinal tract becomes inflamed. Inflammation is most common in the ileum, small intestine, but may occur anywhere in the GI tract, from the mouth to the anus. Fibromyalgia, often a set of symptoms related to another autoimmune disorder, such as lupus or rheumatoid arthritis. There is pain in various parts of the body. Location and even the existence of inflammation is unclear.